I am Dr. Lavi. I am the author of Clinical Assessment of Pragmatics, the CAPS test. And I am here today to show you what the CAPS kit entails and how it works. It is available as a print kit. So it has the manual, the protocols, and a USB drive, as simple as that. So let's take a look at what's inside. Now this test is so unique and it's so different because it's the very first video-based assessment of pragmatic language. Because social communication is so dynamic, it involves so many variables, like ability to read paralinguistic cues, like ability to detect facial expressions and know the meaning of those, or ability to use facial expressions to convey certain messages, like sarcasm or disappointment, expressing various emotions. So that's why videos, I believe, are the most accurate way to elicit most authentic responses from our students and to understand their ability to use facial expressions or even read facial expressions, as well as understand the whole dynamics of social context. Now, what's exciting about it is that it comes on a USB drive, just like this. All the videos are right here, which can be played on a laptop, or you can play it on your tablet using an adapter like this. So we just plug it in into the adapter, or even your smartphone. How exciting is that? And what is so special about CAPS is that this is the very first test that looks at pragmatics from 2 points of view. So we're looking at comprehension. We have 3 subtests on comprehension, and we have 3 subtests on expression or performance, ability to perform and show your pragmatic language abilities. So we have 3 and 3. And the 2 very important subtests are the paralinguistic ones. So this is the first test that looks at comprehension, that is detecting facial expressions, ability to read people's faces, and at the same time we're also looking at paralinguistic signals, expression, and that is ability to use facial expressions, overall affect, body language for conveying certain messages and emotions. Now, another interesting aspect of this test is that we differentiate communication or pragmatic language specifically into instrumental versus affective communication. So an example to make it easier to understand what we mean by that is that many of our students on the surface have good communication skills. So they're able to express their basic everyday needs. So many times to the teachers, maybe the parents, their language skills appear to be intact. However, if you look much deeper into their higher level, more complex, affective communication, so messages that involve certain emotions, now this is where the deficits are. So we're able to differentiate the 2. And when we administer the test, we get our scores. Usually our students get really average scores on the instrumental aspects of the subtest. So students with social communication difficulties will score on average on their instrumental subtest tasks, but will have significant difficulties on the higher level affective subtest. And we use that in our meetings with the parents, the teachers, to explain why our students on the surface look like they're capable and able to communicate effectively. But then we contrast the 2 subtests, and then we demonstrate now the problem, the difficulties, the deficits are in the higher level language, the affective communication, especially those paralinguistic aspects of communication. So the CAPS test will will provide standardized scores, percentile ranks, and scaled scores. And what's great about this test is that you are able to administer all the subtests individually. So you don't have to administer the whole test. You can only use the paralinguistic ones if you need to look deeper or examine their ability to read faces and to use facial expressions, for example. If you have any other questions, call us, email us. We're here to help you.